Well, joining me live now is the immediate past president of the Australian and New Zealand Intensive Care Society, Dr. Anthony Holley. Doctor, appreciate your time this morning, and just an apology here in advance that if the Prime Minister pops up, we're expecting him live shortly, we'll have to go to him. But first of all, just for those to give us a mental picture of what things are like in ICU, in the ICU at the moment in hospitals, just explain to us how it is, how things are going and how the system is coping.
Thanks very much, Peter. Look, it's an incredibly challenging time for Australians and indeed healthcare workers across all professions. Intensive care is a finite resource, and so a lot of planning has gone in to ensuring we are best prepared for the numbers that are requiring critical care. To answer your question, we spend our days in personal protective equipment, under gowns and masks, and in various isolated parts of the intensive care units. For Queensland and South Australia to some degree, this is relatively new, where our colleagues in Victoria and New South Wales have been hard at this for months. And so the challenge really is not only delivering the standard of care which Australians expect, but also for those healthcare workers to remain strong and positive and deliver that care.
We had Professor Paul Kelly on the program last hour, and he mentioned that the hospital systems are coping. By and large, they're coping at the moment. Are they?
Look, I think the first thing I would say is that the Chief Medical Officer's office and the critical care community through the ANZICS advisory group has kept in very close contact. We have a weekly meeting, and not infrequently we receive phone calls. So it'd be fair to say that the Chief Medical Officer, Professor Paul Kelly, is well and truly across the numbers. Peter, it's worth mentioning we established the Critical Health Resource Information System as far back as March of 2020. And this system gives both the Commonwealth and the critical care community situational awareness on a day-to-day basis of exactly how many beds are occupied by COVID patients in the intensive care and what sort of potential redundancy exists.
Okay, well, so what have we got in reserve at the moment for those beds that aren't being used? How much have we got spare?
So, Peter, if I could say to you, as of last night, we had 450 COVID positive patients in intensive cares across Australia. And that's on a backdrop of about 2,000 beds. So the thing people need to appreciate, though, is that critical care continues. People continue to have strokes, they continue to have motor vehicle accidents, and we continue to treat sepsis. So the challenge is that's an additional workload that wouldn't be here in COVID times. But to reassure your viewers, Peter, we've gone to substantial efforts to try to see where we can expand if that's required, so as not to let Australians down.
When you're looking at all the columns, though, ICU is the biggest one, other than deaths, of course, for those who are still fighting to stay alive. So by those numbers that you just provided me, we're only at about 25% full capacity in ICU.
Yeah, that of COVID.
So there's a lot. So there's a lot in reserve there.
Well, those other beds are being used, as I mentioned, for other patients at the moment. So they're not entirely reserve beds because people will continue to have accidents and people will continue to have strokes and heart attacks, and we need to deliver care for them. So what we've got to appreciate is that this is additional, but by the same time, we've spent a lot of time working out how we can deal with this rising number of patients requiring critical care.
Okay, interesting. Dr. Anthony Holley, appreciate your time. We got through it all in the end. Thank you. We'll talk to you soon.
Thanks very much, Peter. Have a good day.